But I want to welcome all of our guests tonight, all of our business partners, our medical advisory team is on supporting me tonight. I'm Dr. Rita McGuire. I'm one of the co-founders here at Wakana, as well as the Chief Medical Officer, and I represent the pillar of health. And what we do every Wednesday night is we have a very exciting topic that we discuss. And after we discuss that topic, what we do is we talk about our products and how our products may assist with challenges that we all have from day to day. So tonight's topic is leaky gut. And many of you may or may not know the term leaky gut, but it's a very interesting health issue that my healthcare professional colleagues can attest to, that is very, very much linked to our overall health. So if you have a leaky gut, if you have a gut that's not healthy, 9 times out of 10, your overall health is absolutely affected. And we're going to talk about why that is. So let's look at the normal gut. On the very left side is what your intestinal tract should look like, right? And what that means is that there are something called tight junctions within the lining of the intestinal tract, so that toxins and drugs and chemicals and bacteria can't leak through, like in leaky gut syndrome, can't leak through and enter our bloodstream. So you can see when there is inflammation and damage and inflammation can come from, and we'll talk about where that can come from, but it causes things to get into our bloodstream and travel throughout our entire body when we have gaps in our intestinal tract or an area where our gut can leak, hence leaky gut syndrome. So let's talk about what that looks like when our intestinal tract is inflamed. Well, inflammation damages the lining, as you saw in the previous slide, and causes major important nutrients to be unable to be absorbed in our body. You know, major nutrients like carbohydrates and proteins and good fats and minerals and vitamins. That then leads to an immune response, which causes our body to have what? A lot of food intolerances, a lot of GI issues like constipation, diarrhea, bloating, gas, a lot of pain. And then this can long-term turn into an autoimmune condition. An autoimmune condition means that long-term, our gut that's leaking these toxic chemicals and inflammation that's going on then makes our other organs think that there is an attack. You know, an attack on the pancreas can cause what we see as type 1 diabetes, or an attack on our thyroid gland can cause thyroid issues like Hashimoto's or Graves' disease. An attack on our joints, right, can cause rheumatoid arthritis. Our attack on our brain, there can be an autoimmune response in our brain, could also cause things like Parkinson's and dementia and even multiple sclerosis. So a leaky gut, though seems not so bad, long-term can really have an impact on our overall health. So what are some of the 6 gut killers, as we call them, right? What is it that we may be doing right now that's causing our gut to be predisposed to have a leaky gut syndrome? Well, one thing is antibiotics. And you know, in practice, I'm one of those physicians that you couldn't twist my arm to give you an antibiotic if there was no reason to give you an antibiotic. Lots of people will take antibiotics if they start coughing or sneezing. But antibiotics, we know, along with other medications like Motrin, Aleve, ibuprofen, acetaminophen, Tylenol. All of these drugs long term can cause the breakdown of the lining of your gut and cause leaky gut syndrome. Another thing is processed grains. Processed grains are foods that can't be broken down by our intestinal tract. So long term, what happens? Well, they start to cause inflammation, and inflammation causes those gaps that you saw in the intestinal tract, thus causing leaky gut syndrome. Sugar, oh my gosh, absolutely. If you got sugar in your diet like that, sugar, or even hidden sugar in your white products like white potatoes and white rice and white pasta, please take those out. Stress, oh my goodness. Are we under a lot of stress? Yes, we are. Long-term stress can lead to leaky gut. Long-term stress can lead to inflammation of the lining, which can cause those breakage in the lining. Poor sleep. Poor sleep can also cause the gut not to be healthy. Again, poor sleep interrupts the circadian cycle. Circadian cycle all relates, and we'll talk about it, that gut-brain axis. And then alcohol, pesticides, and other toxins. Limit alcohol, limit nicotine. Some pesticides you just can't get around, right? And your fruits and vegetables, there are things that are hidden. So absolutely these cause leaky gut syndrome. How about bacteria? Well, there are good bacteria and then there's bad bacteria. Well, the good bacteria at the top, bifidobacteria, E. coli, lactobacilli, these are good bacteria that actually have been found and researched to improve memory, because we're going to talk about that gut-brain axis. Those are bacteria that you want around. They help to prevent a lot of bad things from happening to our immune system. They also help to prevent, like E. coli, the good type of E. coli, helps to improve and lessens the chance of our blood clotting and several other illnesses. There's lactobacillus that actually helps to prevent carcinogens from coming around. There was a lot of studies done in the African American community, and what they found was that there was a study that showed that those that barbecued a lot, right, that used charcoal to barbecue had an increased risk of colon cancer. Why? Because the charcoal would then stick to the food, the meat, the ribs, the polishes, the burgers, and chronic long-term eating of foods that had charcoal was not good because our gut can't break down charcoal. What happens? That food just sits around in the gut, which then causes not only leaky gut and toxins leaking into your bloodstream, but actually cells within the intestinal tract becoming cancerous because they just can't be metabolized. Bad bacteria also can break down our gut, like Campylobacter, Enterococcus, and Clostridium. These are pretty harmful and very dangerous bacteria. So we want to make sure that we talk about a little later probiotics so that we can really help our intestinal tract to have more good than bad bacteria. So leaky gut syndrome affects the entire body. And we're going to go more into detail, but it affects our glands called the adrenals. And that's why when you have a poor diet or you have one of those 6 gut killers that we talked about, medications, processed grains, sugars, toxins, stress, you're not sleeping well, well, those adrenals are also causing fatigue. The colon, when it's affected by toxins that are now leaking out of the gut into the bloodstream to different organs like the colon, It causes constipation and diarrhea. Again, we talked about how leaky gut and those toxins and poisons are leaking into our bloodstream and they travel to the joints. They cause a lot of pain. They can cause rheumatoid arthritis and fibromyalgia. Even leaky gut can lead to thyroid issues like Hashimoto's, hypothyroidism, and Graves' disease. Now, I graduated from medical school in 1991, in the early 90s, right? And I'm telling you, I was that student that was reading and studying hard, but I got really irritated. This is something that you don't know about me, but I got really irritated because I'd read about these conditions, but never see a patient. Back in the 90s, we just didn't see people with Hashimoto's disease, hypothyroidism, or Graves' disease. I mean, thyroid conditions just were not common. And I never, ever saw a patient who had fibromyalgia. I read about fibromyalgia and lupus, but never really saw any patients. Leaky gut syndrome can also cause sinus and mouth issues, frequent colds and food sensitivities and allergies. The skin is also affected with acne and rosacea and eczema and psoriasis. And then we'll talk about the brain, how toxins leaking from the gut can cause depression, anxiety, and ADHD. And you see it, right? Maybe you're on the line and you are a school teacher and you see those kids who come to school eating hot chili Cheetos, those hot Cheetos and a pop for breakfast, right? You notice that those children typically have anxiety, depression, and even ADHD. So over time, the gut is compromised by that poor diet, and that poor child now has leaky gut syndrome, where those toxins have now traveled from the bloodstream to the brain to cause issues as well. So can this influence this? Can your gut influence your brain? That's the question. And I have a gut feeling that it does. And it's something called the gut-brain axis. And what that means is that there is a reciprocal effect that the brain has on the gut and the gut has on the brain. And when we talk about the brain and the central nervous system, we know that it regulates mood and emotion, our sleep cycle, our sexual behavior, oxidative stress, and cognition and memory. And we also know that the intestinal tract can affect our immune system. It can affect the secretion and absorption of nutrients. So when we have, for example, stress, or if we have a poor diet or we have lack of sleep, it is a cycle that affects mood. Why? Because we know serotonin is one of the top neurotransmitters that is released by the brain if it's normal. But when the gut starts to leak out these toxins and poisons and etc., that then leaks out into the bloodstream, which can then travel to the brain, which can affect the levels of serotonin and dopamine and melatonin. All of these neurotransmitters are important for sleep, mood, sexual behavior, emotions, and memory. So let's look at memory, because I have a lot of friends whose moms and dads are physicians. And of course, they're older, and many of them have dementia. And I've always wondered why so many physicians have dementia. You know, I ask about what was their diet like? What was their sleep like? And you can imagine what it was like. They had poor diets. They never got any sleep. And that was something that at the end of my career was mandated. It was mandated as a resident, you couldn't work that many hours. Now, it wasn't mandated when I was a resident. I would work 2 and 3 days straight. but that is not healthy at all. So on the left side, what you see is a healthy gut. It's a gut that has those tight junctions where toxins and medicine and pesticides and maybe environmental stress can get through. That's a healthy gut. But a gut that has a leaky gut or a leaky gut syndrome, you can see where bacteria and toxins and really bad inflammatory cells that we talk about can get through, pass into the bloodstream, get into the circulation, and it is permeable to the blood-brain barrier. We talk about the blood-brain barrier, right? When we talk about some of our products, but they're able to get into the brain and cause inflammation and buildup of these amyloid plaques in the brain. And you know what it causes? It causes dementia. It causes dementia. So yes, your gut is directly related to your brain, and it is imperative that you take care of your gut. And so many patients you will find and question maybe their children of what sort of sleep habits did they have, what sort of diet did they have, did they exercise, were they under a lot of stress? Yes, physicians that are under a lot of stress, we don't eat well and we don't sleep. So yes, a high amount of dementia. So when our body responds to stress and anxiety, what is one of the first things that happens to you when you're either fearful or you're very stressed out? Well, I know it's too much information, but some of us have diarrhea, right? We go to the bathroom, we're nervous, we're scared, we're stressed out. We start to get stomach discomfort and bloating, and it's just an awful scene, right? And so it is all in your gut. In fact, we're going to talk about how the endocannabinoid system plays into all this and how your diet plays into all this, because that's the only way we can understand these chronic illnesses, many of them that I didn't see when I was in medical school, that's very prevalent now. You know, one being obesity, diabetes, heart disease, lupus, fibromyalgia, multiple sclerosis, and many more conditions. So the diet is very important. You know, I'm big on eating well and healthy, and some things that you can do right now to improve your gut is your diet. You know, staying away from fried food and processed food, you know, eating more vegetables and roots and fermented vegetables and sprouted seeds like chia seeds and flax seeds, and staying away from gluten. You know, gluten is another big culprit with the gut. Staying with healthy fats, avocado and avocado oil, you know, having that fish and herbs and spices. You guys know the things that you should be doing. And then there's lifestyle modifications, right? I take a probiotic every day. It helps to make sure that the good bacteria are there. I love that a lot of our business partners here at Wakana, they practice what they preach. You know, Queen Neff with her mindfulness meditation and yoga, reducing stress. You know, avoid smoking, nicotine, sleep more, get that 7 to 9 hours of sleep. When I found out that sleep is so important, because, you know, we didn't think sleep was important in medical school and residency. I'm telling you, I get in bed. I really try to get that 7 to 9 hours of sleep every night. Limit your alcohol intake and exercise. In fact, I love our business partners, you know, Fatima Horn, she is a Zumba instructor, and Benny is a line dancing instructor. You know, making sure that you're just engaging in things you're passionate, so then it doesn't become a very hard task to get active. So let's talk about now CBD. in the gut. So we're going to look first at the plant, the cannabis plant. Now, the cannabis plant contains over 85 plus cannabinoids or compounds, but the two most common ones are THC and CBD. Now, THC and CBD can both come from marijuana and the hemp species of the cannabis plant. But the difference is that the marijuana species has a high level of THC and trace amounts of CBD, whereas the hemp has trace amounts of THC, 0.3% or less, and higher amounts of CBD. So it's a THC that's psychoactive, that gives you the high, but it's the CBD that gives you the health without the high. So CBD is an abbreviation for cannabidiol. And cannabidiol, again, is the #1 component that we find in large amounts in the hemp species. In fact, CBD was introduced to me in 2017 by our CEO. I had never heard of CBD. You know, they don't teach this in medical school. So it was new to me. But I'm telling you, when I did my research, I did my due diligence, I really dug deep to figure out, you know, how it worked in the body. I was on board because what I found out is that there's a part of the cannabis plant that doesn't give you the high, like marijuana, but it gives you all of the health benefits without the high. And that's really important when we're talking about our gut health, which is linked to our overall health. So what are some of the medicinal benefits of CBD? There's over 20,000 peer-reviewed articles right now that you can use your favorite search engine and look up medicinal benefits of CBD. Lots and lots and lots of studies. But what's important tonight when we talk about gut health is that CBD helps to relieve pain. It helps to relieve anxiety and it helps to relieve inflammation. And those are one of the top 3 things that we see with leaky gut, right? Or a result of leaky gut syndrome. CBD also helps to reduce nausea. It helps to manage blood sugar levels. It also helps to inhibit cancer cell growth or the metastasis of cancer. It also helps to reduce the risk of arterial blockage, because what we find is that those who have leaky gut syndrome have an increased incidence of cardiovascular disease, coronary artery disease, hypertension, right? Why? The common denominator, again, is inflammation. When you look at chronic conditions in Americans, the common denominator is inflammation, right? You look at diabetes, it's inflammation of the beta cells of the pancreas. So now those cells can't produce insulin. When you look at arthritis, it's inflammation of the joints, causing arthritis and joint pain. When you look at inflammation of the blood vessels, what does that cause? It can cause elevated blood pressure. You see inflammation in the brain. We have already talked about it. That can cause not only anxiety and depression and ADHD, but it can cause dementia. So every single organ that is affected, even in thyroid disorders, the common denominator is what? Inflammation. And CBD is a very, very powerful anti-inflammatory, and that's why it can assist with so many chronic conditions. So how does CBD work? Well, CBD works by the science of the endocannabinoid system. And I'm telling you, when Melissa introduced me to CBD, that was one of the first questions that I had. You know, it sounded like a snake oil. It sounded like a magical potion. I'm like, how does this work, right? So there's real science behind how it works. And this is a really detailed slide, but just know that the science is that there are receptors throughout our entire body. Almost every organ and gland has receptors that are looking for CBD. Now, our body produces cannabinoids very much like the plant. You know, it produces anandamide and 2-AG. But because of environmental stress, because of our diets, sugar and processed grains, because of the stress, because we're not sleeping, because we may be having a little drink here and there, the compounds that our body produces, those endogenous cannabinoids, become deficient. So everybody that you know in your life needs CBD. Everybody needs CBD. Why? Because the endocannabinoid system puts the body back in balance when it binds with CBD to its receptor. So on the right side of the slide, yes, it's very busy, but it just shows all the different pathways and receptors that CBD and the other cannabinoids work on that help to improve so many things, from, again, anxiety, depression, seizures, spasms of the colon, et cetera, et cetera. So the 10 main receptors that we always talk about that CBD and the body is looking for, the endocannabinoid system is looking for, are receptors in the eyes, the lungs, the liver, the kidney, the bowel, the skin, the stomach, the teeth, and the heart. Now, remember, we talked about leaky gut syndrome affects almost every organ in our body, right? Once the gut is leaking and the toxins travel from the bloodstream, then they start to attack different organs. So we need CBD around to keep the body into balance, to reduce the inflammation, and to reduce the long-term devastating effect that leaky gut syndrome can have on our body. So there is scientific research that shows that THC and CBD, these cannabinoids, along with many other, can promote a healthy microbiome. It can create a healthy environment for our gut. And so if there's any healthcare professionals on the line, just know that I can provide to you a lot of science. There's a lot of articles, there's a lot of data that has shown how the endocannabinoid system puts the gut back into balance and reduces inflammation. So let's move on to our products now here at Wakana. The FDA disclaimer is that these statements and products have not been approved by the FDA. If you're pregnant, nursing, on medication, please consult with your physician prior to taking any cannabis products. Just know that we cannot make any claims to cure, diagnose, mitigate any conditions. Just know, though, that our products here at Wakana are products you can trust. Our products are tested. They are compliant with the State Department of Agriculture. Our products are organically grown. Our products are industrial hemp registered, and our products are Farm Bill compliant. And that's important, knowing that our products are sourced from the industrial hemp plant containing less than 0.3% or less of THC. We also provide certificates of analysis on our products to let you know, to ensure you, to allow you to see the potency, to allow you to see that our products are free from mold, mildew, heavy metals, residual solvents, and pesticides. So how do you take CBD? You know, this is a really important slide, right? I have a Gen X, a Gen Z. Hannah is a Gen Z, my youngest, you know? And I tell her, Hannah, please hold the oil under your tongue for a minute before you swallow. And it's really important because it allows the oil to absorb under the tongue through these little glands so it can get into the bloodstream, right? So when you take CBD oil, you put it under the tongue, you hold it for a minute before you swallow, it's going to take about 15 to 20 minutes to get into the bloodstream. So it's important not to drink or eat or smoke for at least 15 to 30 minutes afterwards for optimal absorption. So let's talk about Hemp MD. Our Hemp MD is what we call our full spectrum product. Now, full spectrum means that it contains not only CBD and the legal limit of THC, which is 0.3% or less, but other cannabinoids, other compounds like CBN and CBC and CBG. CBG specifically really has been targeted and looked at as really that cannabinoid also, along with the synergy of the other cannabinoids to help with our gut health. And so this product is our most potent product. It's 750 milligrams of CBD in a 15 ml bottle. So this is a product for more severe conditions that you want to address. Now, when the Mayo Clinic looked at CBD and they looked at how much should a person take who has a chronic long-term condition, what they found is that a person doesn't really need to take a lot of CBD. More is not better. And so that's why I always recommend to my patients, to my customers, to my family, and even myself to start low and start slow. So a good starting dose is 3 drops twice a day, 3 drops in the morning, 3 drops in the evening. You can always increase it as high as 15 drops twice a day. But again, this is a full spectrum product. It contains the legal limit of THC. So if you have drug screens at your job, we're going to talk about our pure products, and those are the broad spectrum products for those who have urine drug screens at your job. So this is our Hemp MD. Our Hempranium 500 is another great product. It is a tincture. It's an oil you place underneath your tongue. What I love about this product is that we have a proprietary formula, meaning that we've enhanced the CBD with certified organic essential oils like black seed. Now, black seed is known to help with digestion. Black seed is known to help to rebuild the beta cells of the pancreas. So black seed has many, many medicinal properties that we have enhanced our CBD with, along with turmeric. Turmeric is also an anti-inflammatory. So I hope you're getting the gist of where I'm going here, right? We're synergizing an anti-inflammatory like CBD with other anti-inflammatory essential oils that make this a very, very unique product on the marketplace. We also have added peppermint. You know, peppermint is very soothing as well to the GI tract. So a great starting dose, 3 drops in the morning, 3 drops in the evening. You can always increase that to 15 drops twice a day if needed. And then we have a product that you can infuse in your beverages and your food. And it's a power water soluble. I love using this product on those who have cognition issues. They either have dementia or maybe they may have Parkinson's. It's that population of seniors that may not be able to hold the oil underneath their tongue for a minute. So I love the power water soluble for those people. And then I love it for people like me, right? For those people who are on the go, busy, you know, I just drop it in my water before my workout, or I may drop it in my oatmeal. But it's a great product that you can use in beverages and food. And again, 3 drops in the morning, 3 drops in the evening is a great starting dose. And if you need to go up, the maximum is 15 drops twice a day. And then our culinary product. This is another tincture, means you can put it underneath your tongue, but you can also bake with it. You can also cook with it. So it's a great product to have fun with as you are eating healthy, right? But 3 drops in the morning, 3 drops in the evening. Again, 15 drops twice a day is maximum. If you are baking or cooking, make sure that you don't bake or cook over 350 degrees, only because if you cook or bake something higher, you're going to just burn off all of the great qualities of the cannabinoids in the bottle, and you don't want to do that. So this is just a chart I love sharing. In the event you need to dose someone that may be morbidly obese, or maybe someone that is smaller, like a child. But this is a great dosing chart that helps you to increase if needed, if our recommendations on the bottle needs to be tweaked. So with the products that I just spoke about, each drop, one little drop, not a whole dropper, is 1.67 milligrams. So you can dose person via their weight and the level of discomfort that they're having. And then our gummies are amazing. Another great way to address leaky gut syndrome. Why? Because typically that sleep deprivation long term can cause issues with our gut. So our gummies are a great way to assist with a restorative sleep. Now, gummies take about 30 to 90 minutes to kick in. So you want to take this gummy about 30 minutes or an hour before you're going to retire. Each one of our power gummies is 25 milligrams, vegan, non-GMO. Just a great way to address not only sleep, but inflammation as well. And then again, our gummies also on the left are our full spectrum gummies containing the legal limit of THC, which is 0.3% or less. And then we have our broad spectrum gummies. That's our products that contain less than 0.0% of THC. And also those are the products that you're going to use if you have random drug screen. So our new broad spectrum gummies actually contain 60 milligrams of CBD. So just some great choices. And then how about topical relief? You know, topical relief is needed. Typically, those who have leaky gut syndrome have bloating, they have pain, they have discomfort in their abdominal area. So absolutely our topical relief is now 400 milligrams in a larger jar. We also have a proprietary formulation on our cream, meaning that we've added essential oils that address inflammation and analgesic effects. So it's a great way to address abdominal pain. And then we have a 500 milligram. You know, a lot of people ask, Dr. Rita, what's the difference between the 400 and the 500? Well, they're different formulations. The 400 has 8 certified essential oils that are in addition to the CBD, and the 500 has 6 essential oils. So it depends on really the person. It depends on the level of discomfort. I use all 3 of our topical products different times for different reasons. Our Dr. Rita's rub is in a liquid form. I love using this before my workouts. It helps to get me through the workout so that shoulder and knee and back doesn't give me any discomfort. Now, this particular formulation now is enhanced with 19 to 20 essential oils to help reduce inflammation. And what I love about the fact that Melissa Boston introduced me to CBD is I've not taken Tylenol, Motrin, Aleve in 3 years. I've not taken any over-the-counter medication. And what does over-the-counter medication do long-term? There are studies that show it causes leaky gut syndrome. It compromises the integrity of the lining of your intestine and long-term can cause leaky gut as well as kidney and liver failure down the line. And then our fast-acting products. You know, I was talking to one of my new business partners and I told Phil Crawford, you know, divide our products into 4 sections: tinctures, topicals, our edibles, and our fast-acting pre-rolls and vapes, right? Keep it simple, 4 things. So our diamond pre-roll is a CBD joint, but it's not a joint that gets you high, right? We talked about this already. CBD sourced from the hemp, industrial hemp plant, will not get you high. So none of our products will get you high, but they will give you the health without the high. It works within 1 to 5 minutes. 1 to 3 pulls will really assist those who are having symptoms due to leaky gut syndrome, that pain, that bloating, that discomfort. And then we have vape oil cartridges. Again, fast acting, 1 to 3 pulls is really all you need. You don't need to smoke the entire cartridge or the entire joint to be effective. And then our pure nano tincture is a 300 milligram CBD. This is that broad spectrum product I talked to you about. You know, those who have random drug screens will use our pure tincture, our pure gummies. What I love about the topicals, if you have random drug screens, you can use the topicals. They will not pass the blood-brain barrier. They will not get into the urine. So this particular product, you have to hold under your tongue for a minute before you swallow. Each drop is 1 milligrams, but again, start low and slow. More is not better. So start with 3 drops in the morning, 3 drops in the evening, 15 drops twice a day is the maximum dose. Many of you may be on medication and you ask, is there a drug-drug interaction with CBD in my medication? There are some studies that show that CBD can increase or decrease the effectiveness of the medications you're on. Now, I've done extensive studies, and what I found was that it would be large doses of CBD, like 1,000, 2,000 milligrams, to conceivably interact with your medications like warfarin, which is a blood thinner. But because everybody responds differently and metabolizes CBD differently in the liver, we want you to let your doctor know that you're using CBD if you're on a blood thinner called Coumadin or warfarin, right? Doesn't mean you can't take CBD. All it means is that your physician has to do more frequent testing, your INR levels. So theophylline, that's another medication that we use for asthmatics that CBD can cause a decrease in theophylline levels, meaning it won't be as effective. So if you are on theophylline, let your physician know that you're wanting to use CBD so that you can be monitored closer. It doesn't mean you can't take it. And so there are other medications that are not affected, like some HIV medications, some chemotherapies. There is a medication for seizure disorder, epilepsy in children that may have increased levels. It's really important to store our products. Our shelf life of our tinctures are a year. The shelf life of the gummies are 6 months. Typically, they're not on the shelf that long, but you want to store your products in a nice, cool, dark place, out of the extreme sun, out of the extreme heat. It's going to be getting cold soon. Making sure you refrigerate that water soluble, that power water soluble product. Keep that in the refrigerator for sure, and make sure you shake it well before each use. So there are 3 types of people typically at the end of all of our webinars. One is, you loved what you heard. You understand that, oh man, now I understand that my gut health is really dependent on my overall health. If I don't have a healthy gut, long term, it can cause so many things to go wrong. So I want to start your product. So whoever invited you, you want to get with them after this call, and you want to make sure you get those products ordered. There's others that still have questions. We're going to open it up for questions, meaning you're going to put your questions in the chat. And then number 3, you want to know more about our company. This sounds really, really interesting. I think that I can really share this product with many, many people. So I want more information. Yes, you're able to get more information. Tomorrow night, we have a millennial call at 8 p.m. So whoever invited you, you want more information about our company and our business plan, our compensation plan, they can invite you to that call. And then Saturday at 10 a.m. I know the dates are off. Don't look at the dates. Just know that we have opportunities for you to learn more about Wakana, to learn more about our compensation plan, and to learn a little bit more about our products. This is my email address. So if you have any questions, if you want to email me, please do that. But we're going to open it up now for questions. I'm going to stop sharing my screen. I've got my medical advisory team here. They're going to assist me. We have Dr. Charlotte Mitchell. It says Mitchell Charlotte. She's an internist here in Chicago. And then we have Dr. Natasha Gettings, who absolutely is involved with the brain. So we've got child and adult psychiatrist, Dr. Natasha Gettings, and we've got some internists and family practitioners that deal with the gut. We've got a licensed clinical social worker, Erica Zachary, and I'm not sure if Erica Zachary wants to share, but if you want to share, if you want to make a comment as we're taking questions, please unmute yourself. Let's see. How many of the products should you take at once, or should you just start with one? Very good question. So I recommend that you start out what we say, Dr. Joy Smith, the trifecta, and that is our tincture or our water soluble twice a day, our topical to offer local relief in any area that you may need local relief, and then a gummy at night. I think that is a great way to start our products, because honestly, most people's endocannabinoid system is out of balance. And it's out of balance because of the things we talked about, right? Many of us have taken years and years and years of Motrin and Aleve and ibuprofen and Tylenol. Many of us, so we know that our endocannabinoid system is out of balance from the foods we're eating, the water we're drinking, the air we can't get around breathing the air, the sleep deprivation, the stress we're under right now with the global pandemic and social unrest. Absolutely. I recommend tincture, topical, and that gummy at night right out of the gate. Great question. Says Dr. Rita, will our 500 milligram Hempranium help someone who has begun to see floaters in their eyes? Well, somebody who has floaters in their eyes need to find out why they have floaters in their eyes. They need to get examined by their physician, because floaters in your eyes could mean all sorts of things. You guys can hop right in. I'm going to plug up my laptop so I don't lose the entire presentation.
Yeah, this is Dr. Crawford, Family Medicine. Yes, as far as the floaters, that needs to be checked out for whatever cause it is. And in general, the CBD would help with inflammation if it's related to inflammation.
I'll take the question about can the gummies help ease the effects of anxiety? So going back to Dr. Rita's talk tonight, a lot of our issues related to anxiety come from stress and adrenal glands that are overworked. And a lot of the hormones that our adrenal glands make are directly interacting with our endocannabinoid system. So when you have been exposed to years of stress and being overworked, not sleeping well, unhealthy lifestyle habits, all of those things, your adrenal glands are really fired up, cortisol, adrenaline. So CBD helps to calm that system down, and they work in concert with one another. So absolutely, CBD can help with anxiety.
Hi, so this is Erica. I can jump in there too. So I will say, so I'm a mental health therapist as well. But I've learned something about myself because I had a lot of issues with social anxiety and speaking in groups like this. So one of the things I usually do is even today, I use my vape because my vape also helps me when I'm anxious about anything. So it assists me in that way. And then, I also use gummies at night and other things for my MS as well. Yeah, that's one of my friends. It's here on my table, on my desk.
Thank you, Erica. Thank you, Dr. Gettings. Thank you, Dr. Crawford. We're going to take, let's see, I want to go in order. Good evening. Does any of these products help with fibroids? So fibroids are benign growths of the uterus, of the womb. There are studies that show that women of color have an increased risk of fibroids. They feel, a study that was done out of Rush University found that we may have more growth hormones as African American women, but there are no studies that I have found to show and You may correct me if anyone's seen a study on CBD and fibroids. But what we can say is that CBD can assist with the symptoms of fibroids. And what are some of the symptoms of fibroids? Well, one is pain. It's very, very painful, heavy bleeding, absolutely using the topicals, the tinctures, again, the gummies, all of our products to assist to reducing pain. What do most of my patients take for pain and heavy bleeding? Motrin and Aleve. And so we want to alleviate that. We see that those medications not only can cause the integrity of our gut to be compromised and cause leaky gut down the line and issues, but it also can cause kidney failure, Tylenol causing liver failure long term. So absolutely, CBD can assist with symptoms due to fibroids. Okay, we talked about anxiety. These are great questions, you guys. Now, let's see, hot flashes, same thing. Hot flashes are a result of a decrease in estrogen in women, typically over the age of 50. We start to get mean and evil, and we're hot and we're cold, we're hot. We can't sleep at night because we're so hot. So we wake up tired and irritable because we didn't sleep because we were tossing and turning. So yes, CBD again, because we can't make any claims, but CBD may assist with symptoms due to menopause, helping us sleep, helping CBD to bind to those receptors, right, Dr. Gettings? Yes. Bind to the serotonin and dopamine receptors so that those neurotransmitters can be released and help us sleep, to help improve our mood, to balance, the hormonal levels that we are faced with. So yes, CBD can assist with those symptoms.
Okay. I see that the CBD assists with memory, going back to brain health and the fact that we just went through the brain-gut connection and inflammation. One of the reasons why so many people are at risk for long-term neurodegenerative diseases like Alzheimer's and other causes of dementia is because of inflammation. So CBD is a powerful anti-inflammatory. So supplementing with it or using it daily can definitely help with brain health and protecting those neurons that are responsible for your memory centers.
Dr. Rita, I've been diagnosed with fibromyalgia 4 years ago and hypothyroid 8 years ago. I want to avoid issues with random drug testing. So what do you suggest I take? I have ordered pure gummies for the first time this past weekend. I just chose to stay clear of pain medications. What else would you recommend, ladies? Outside of the pure gummies that she's ordered?
It's a pure tincture that my husband uses he's a truck driver. He hauls cars for a living, so he cannot come up positive because we need his income. And so he uses that for, sometimes because he's a car hauler, a lot of times he is pulling and pushing on things with his hands. So he's using the not only the tincture, but he's also using the topicals. So because the topicals, it doesn't matter. It doesn't leak through it doesn't cross the blood-brain barrier. So you're safe to take those, even though it says it's a power product.
Awesome. Awesome. So let's see. How can I say this? When you are trying to figure out what to suggest for someone who has a condition, we talked about tonight that almost all of the chronic illnesses that we see today is due to what? Inflammation. Fibrosis, arthritis, diabetes, hypertension, dementia, memory, anxiety, all of that gut, brain, gut, thyroid, gut, joint, gut, adrenals, gut. The gut affects every single organ. It's sad when it leaks, It leaks into the bloodstream and it can attack your entire body. So you want to make sure that that person is on CBD. And you want to make sure that that person that has chronic long-term arthritis is not on a gummy. You know, a gummy is not going to really be sufficient. Most chronic long-term conditions that people are really seeking a holistic, natural, organic relief for will need the tinctures twice a day. They'll need the topical for topical local relief. They'll need that gummy at night, and they may need one of the fast-acting products that help to get into the system, vaping, pre-rolls, flower, within 1 to 5 minutes. So try to think about it that way, because what you want to do is that you want to get the endocannabinoid system in balance. And once we're getting resolution and relief, then we can start backing down. Then you don't need as much CBD. You won't need, you know, people ask me every day, am I going to get addicted to having to take a gummy every single day to sleep? Well, once the body gets back in balance, once you start exercising, once you start improving your diet, once you start doing your yoga, your mindful meditation, all of these things is a synergistic relief that we see, so that we can sleep, we'll be less anxious, less depressed, and the inflammation in our bodies reduce. So it's not just one thing, it's a lot of things that we have to do in order to get the optimal relief and the health that we're really looking for. And CBD is that way of assisting with all of those things. So I hope I made it clear that you don't have to make it complicated, like, oh my God, what am I supposed to, you know, what should I give this person? CBD. CBD, you know, and it just depends on the person's weight, the way they metabolize it, their body chemistry. Some people need 3 drops twice a day. Some people need 6 drops. Some people need 8 drops. Just let them know we're going to start low and slow, and we're going to build you up to wherever you need to be. Anything else?
Dr. Rita, there's 2 questions in the question and answer that I couldn't answer.
Okay. Good for sleep apnea. Is Accutane a drug that is okay to take with CBD as long as it is in a small dose? And what does Wakana think about facial scrub? Facial scrub, we don't have a facial scrub, but if you could maybe be a little bit more specific about facial, we don't have a facial scrub, so maybe you're asking, can you put the product in a facial scrub? I'm not sure. Accutane, we would have to look that up. I've not seen Accutane on the list of drug-drug interactions. Doesn't mean that it's not on a list. So that is something that we can absolutely get back to you. We'll talk to Dr. Joyce Smith about that. And what was the other question?
Oh, I think the sleep apnea, well, as far as
apnea. Yeah, sleep apnea, same thing. Chronic long-term inflammation causes a lot of, we see sleep apnea in those who are typically overweight, those who have a lot of inflammation in their body. And so with weight reduction, with calming down the inflammation, that helps a great deal, along with all of the other lifestyle modifications, you know, taking alcohol out your diet, taking dairy out your diet, you know, all of these things are going to help improve sleep apnea. So not one thing is helpful, but it's a combination of lifestyle modifications as well as our amazing products. Okay. Anything that anyone wants to say? It's 9:01. We've got to let everyone go. If you have questions, please contact the person who invited you on the call. You absolutely can email me at ritamd@wakana.com. You can contact your sponsor. You can contact the person that invited you so you can get these products ordered so we can get our gut healthy, so we can really take back our health, our wealth, our legacy, and our freedom. Please join us if you want more information about our company, our compensation. We absolutely have calls tomorrow at 8 p.m. and Saturday at 10 a.m. Is there anything you want to say, Erica, Dr. Gettings, Dr. Crawford, Dr. Mitchell, before we end it? Anything that I may not have covered or you want to?
No, I saw a comment, and I'm not sure. I don't think we answered it. Somebody had a question about using CBD daily, and I was just going to say, I am definitely a product of the product. I have so many products sitting around this house because I have MS. I've been chosen to manage naturally for 22 years at this point. So when I found Wakana, it was a saving grace for me, trying to find a product that really worked. So I use my tincture, my MD tincture every morning, my Hempranium MD every morning. And then I follow that with, usually I have water soluble. I put it into whatever I'm eating later in the day when I first have my first meal, or in my coffee. I use a gummy at night. I usually use our black seed oil as well because I'm trying to just fight inflammation. So I'm pretty clear that everything that I need to do is to fight inflammation and to manage my diet. I realize that CBD is not going to do it all on its own. I need to change my habits as well, which I've been working to do on a regular basis. And so the one neurologist that I loved that I had years ago told me to change my diet. It's the best thing he ever told me. He's like, read your labels, know what you're eating. If it doesn't sound like a food, don't eat it. And so, and then basically that's what he told me, and then to exercise. And I took that to heart. So, and I have an MS Gym group that I exercise with on a regular basis. I have a Black Girls Move group that I've empowered other Black women who have not been exercising, but also have MS. And so we can exercise together. But it's not going to happen on its own. You got to do other work. So.
Thank you for that share, Erica. Multiple sclerosis is what she's been living with and just really addressing it in a holistic, natural way. And that is very powerful. Thank you, Erica, so much.
Sure thing.
Yeah. I just want to say thank you for emphasizing once again the importance of the gut-brain connection. I think that the way we're taught about the human body, we're a lot of times stuck on thinking about things operating separately. So when people think about depression or they think about anxiety, they don't always think about what did I just eat. But I tell people, if you want to know how connected the gut and the brain are, just drink. Keep drinking, and you'll see real quick how closely they're connected. So I don't see why sometimes that concept is so hard, but a lot of times I think people struggle with putting that together and putting their nutrition first.
Thank you so much, Dr. Gettings. So true, so true. I mean, you just think about when you eat a heavy meal, right? What happens? You just get lethargic and sleepy. So there's truly a direct connection with our brain, our gut axis, and it's something that we really should pay attention to and be very serious about. And that's why I wanted to have this discussion tonight. And I think it is something that you can share with your family, your friends, your customers, as well as your prospects. So thank you all so much. I'm going to go upstairs and put some Cytotec in a woman that needs to be delivered. She's been here for 2 days being induced. This has been great. Please contact the person who invited you. Let them know if you're number one, which is a customer, number two, maybe you still have questions and you want to get on a call tomorrow night or Saturday morning because you want to really know more about our company and what we're about and maybe locking arms with us here at Wakana. So have a good evening. Thank you, Dr. Crawford, Dr. Mitchell, Dr. Gettings, Erica Zachary. Thank you, CEO Melissa Boston. We want to see everyone tomorrow evening at 8 p.m. for that millennial call. Thank you.
Night.